on session on intervention. So in this session, the chairperson is Dr. T. Sundar, Dr. Ashish Nabar, Dr. Arun Mehra. Dr. Arun Mehra, I think he has a bad throat, so he should be excused. And Dr. T. Sundar and Dr. Ashish Nabar. And there's a little change in the presentation. Dr. Gokhale will be presenting first because he has to go for a cardiac transplant. He has to do that. So he has requested us to prepone his talk. So I am just informing the chairperson. So over to the chairperson to conduct the session.
As Dr. Mahapatra said, that Dr. Gokhale expressed a request that he has a cardiac transplant to go at about 2:30 and could he get it first? And Dr. Mahapatra very kindly agreed to the same. So in interest of the time, could I request Dr. Gokhale to start his presentation? And Dr. Gokhale is a senior cardiothoracic and transplant surgeon in Apollo Hospitals, Hyderabad.
Thank you very much. Thank you, Dr. Mahapatra, for obliging my request. And I was asked to talk on heart transplantation in India. And we all know that heart transplantation in our country is picking up thanks to a few people who have been the leaders in this area. Now, some of the achievements, let us see what happened in this area in our country. Now, we all know that the first heart transplant actually was done in a long time back. Immediately after, in 1968, the first transplant was done in 67. In 68, Dr. P.K. Sen did in Mumbai. The patient died in about 3 hours. But what is important is he is actually the 4th surgeon in the world to attempt this transplant. And actually, that was the 6th heart transplant that was attempted in the world. And after that, the actual transplant program started when Professor Venugopal did the first successful heart transplant in India, in Indian Shore. And after that, that is the time when the brain death declaration was actually legalized in our country. And after that, the transplant program has picked up slowly. This slide shows the number of donors versus the number of transplants done in all these areas, in all the organs. You can see the one in green, slowly the donors picking up, reaching about 875 to 1,000 donors now. And of course, the kidneys, each person has got 2, so obviously the number of cadaver transplants will be high. Whereas in case of heart, it was very slow initially, but then slowly picked up in the last 4 to 5 years. You can see in the next slide, this is how the numbers are picking up from almost about 10 cases, 10, 12 cases in 2011-12, slowly reached its peak in about 241. And then 2019 it was 187. In the last 2 years, again, they are about 250 per year. And these are the states in which there are organ donation programs. Not all the states do not have active transplant program. Mainly the states in South India have got a more active programs. Now, of course, even the north, other areas are also picking up with time. And now today we have a society, Indian Society for Heart and Lung Transplant. It has got some database on the number of transplants done. There are nearly 70 hospitals in our country which have done 1 or more heart transplants in the last 2 decades. And the total number of transplants as per INSHLT database till April 2021 is about a little over 1,100 heart transplants are done in our country. Of course, the numbers are low, but then most of these numbers are done in the last 4 to 5 years. And most of the transplants are done in Tamil Nadu, followed by Maharashtra, and then the Delhi has done the 3rd largest number. The other states actually split the remaining number of transplants. And we have the legal mandate, as I mentioned before, the first heart transplant, successful transplant done in India and Shore. We have this Human Organ Transplantation Act passed in 1994. That is when the brain death declaration was clarified so that it became legal to declare brain death and take the organs. And today we have a national Apex Center for supervising these transplants in our country. This was established in 2011, NOTO at national level under Directorate General of Health Services. And it is the Apex Center for all India activities of coordination and networking. Theoretically, And this is supposed to lay down policy guidelines, network all regional and state level organizations, collect registry data, conduct awareness programs, and form the various subcommittees and all the aspects of transplant. It is supposed to supervise and coordinate at the national level among all the centers in the country. And today we have a lot of professional associations have formed to increase the awareness and knowledge and the experience in this area. As I mentioned, Indian Society for Heart Lung Transplant, Society for Heart Failure and Transplant, Heart Failure Society of India, all these have increased the awareness, especially in the last 1 decade. And we also have some publications about Indian experience. So for a long time, we have been talking of 10-year, 5-year surveys from other centers like ISHLT. But today we have some publications coming in our country from some of the big centers, from Tamil Nadu, from all the areas, from Delhi, All India Institute. Many centers have published some experience in this area, so that today we have some knowledge of what actually are the results of transplant in this country. This was published by Bala in 2020 out of his experience in 257 patients that time. By the way, Dr. Bala is the first surgeon to complete 500 heart transplants in our country recently. And he has shown that even at the end of 60 months, there are about 60 to 65% of the people are alive. The survival estimate as per Kaplan-Meier. Of course, the numbers are definitely lower compared to the ISHLT data, but we have to remember we are evolving, even though we have the knowledge and experience. It takes time for us to reach the world standards. Certainly, you can see in the next few slides that the results are getting better. For example, this is a slide published from All India Institute, which showed their results in 2014 to 16 and then 2016 to 18. You can see with the experience, the survival rates are improving. And again, they have shown clearly that in the initial part of management of immunosuppression, they had higher rejection infection rate, whereas 2016 to 17 onwards, the rejection episodes and infection episodes have come down with increasing experience. Similarly, others have presented the incidence of bacterial infections, viral infections, and certainly these infection rates are higher compared to abroad, including tuberculosis, but certainly not too bad. Most patients are doing very well. Then, of course, what are the challenges? Why the numbers are still low in our country with a huge population? The issues for NOTO, even though it is an apex body, we have to remember health is a state subject. So the state governments take a major role in shaping their health budget as well as the behavior of the organizations in the state. So the coordination among the NOTO and the local and regional center is not really smooth. And it lacks a legal mandate and provisional collection of data. For example, you want to have a registry, data need to be submitted, but it doesn't have that legal mandate yet. And we do not yet have a central allocation system. There are certain delays. We know there is a large number of patients who require heart transplant, maybe about 25,000 plus in our country, but the donations rate is very low. Previously, it used to be 0.05. On average, it is now 0.5 per million compared to many other countries. It is low. But in some states like Telangana and Tamil Nadu, it has actually reached 2 per million. But most of the states, it is very, very low. But then we have a huge pool of potential donors, especially the accident victims. As you know, nearly 410 people die every day and 17 every hour. And many of them, if treated well in a good critical care, and obviously if they declare brain death in time and manage them well, will have a huge potential. And brain death declaration is a huge problem in our country. And somehow it is linked to the organ donation. That's why many people are not keen to talk about brain death declaration, declare patients brain dead. In this way, Kerala has taken a lead by separation of the brain death declaration and organ donation. So every patient admitted in ICU, if they are dead by brain death, they say brain death declaration. And you don't talk about organ donation until after these things are clear. So many states need to follow the system yet. So obviously, if we all put an effort, the intensivists, the anesthetists, and neurosurgeons, all these could put an effort, increase from 0.5 to 1 per million, the donation rate will have nearly about 1,000 hearts. And if you imagine going by about 5 per million or so, we'll have 5,000 hearts. There is going to be a huge pool at some stage, in spite of increasing in the awareness of the critical care, avoiding accident, still huge accidents happen. There is so much gap still Are we using all the donated hearts? Definitely not. You can see the red line showing that there is a gap between the donated hearts and the number of hearts that are used. Some of the reasons are marginal donors. The hearts are not useful for transplanting for various reasons, age factor, LV dysfunction, trauma. Sometimes they delay in allotment and sometimes in transport, very difficult to transport from one area to the other in our country, as we all know. So in spite of the green channels, for example, state government like Kerala is providing air transport help, but most of the states do not provide the support. We need some support. And we need to look at preservation methods, advancements, including ex vivo perfusion methods, which are very costly. There are new things that are coming up. We have to catch up so that whatever we have, we can use. And do we have to change the donation from opt-out method? That means if someone is dead, brain dead, you go and ask the attendants for donation, to the other method where you presume they are giving organ unless they say no. That is opt-out method. Like in some countries, do we need to look at that? Other area is DCD donations, even after arrest of the heart, sometimes you can revive and use them. Some of the countries are working. We are yet to enter into those areas. So what do we need to do now to promote transplantation? We need a lot of awareness among professionals through dedicating some time on heart failure and advanced management methods in societies like CSI, IACTS, critical care and anesthesia societies. NATO-owned state bodies, they should have more efficient allocation systems. And we need to have compulsory participation in national registry, and we need to find a way to develop financial support. And all the leaders in transplantation should spend some time to work with state bodies to promote some of these changes. And we need to form some groups to cover some hospitals. Every hospital cannot have a good transplant setup. And again, we probably need to share resources like ex vivo perfusion system. This is something that will happen in future. And I'm sure the future is like this. The initial part was like this. The first part was like the train, which worked on coal, moving slowly. Now we are moving definitely faster with the electrical train. Now I think in the next few years, with more donations, efficient cooperation, NATO taking over, will be probably the transplant program will move like a rocket, like a bullet train. And I wish that is what we all would like to see. I thank the organizers again for giving me this opportunity to talk on the state of heart transplantation in our country. Thank you.